All right, great. We have Dr. Brendan here from Toronto, Canada, and he is an osteopath and has a very good amount of knowledge on the fascia. I met him on Instagram. There is a lot of good information on his Instagram. Um, we're going to invite him to talk about fascia and what he knows and what he applies in his day-to-day work.
You can have fascial lesions globally, locally, or focally. Like a fascial
Yes,
lesion doesn't have to be one pattern. You can have the fascia up here gliding this way and the fascia down here pulling the opposite way, and it's creating distortion in the fascial layers. And one thing that's really, really fascinating about fascia is it's one continuous layer. There is no beginning and no end.
right.
And it wraps around every blood vessel, every nerve, every organ, every muscle, every tissue. And when it's developing in embryology, it develops based on folds. So how I kind of explain it to people is um, it basically like folds around a muscle or organ or tissue, and then it'll kind of like fold in on itself and then around like so everything is connected. So basically, another example is like if you had a bed sheet and you put it around me, and then we put it around you, and then we put it around another person, and then another person, and someone at the end yanked on it, we would all, move towards that tension.
Exactly.
And when a lot of therapists think about the body, and I talk to a lot of massage therapists and physiotherapists, they really want to know like what muscle is causing this dysfunction or like what trigger point is causing this. Things don't really work in isolation like that because if there is a trigger point or an irritated tissue, things glide towards it, and now that starts to affect the other things that area attaches to, and then the things on the back have to compensate by contracting to stabilize that joint up here. So it's a full body challenge per se, and it's your body's way of fighting under gravity. So it becomes like a full body issue all the time.
Right.
And in my opinion, I think the full body should be looked at anytime we're looking at any sort of dysfunction.
I
And
fully
yeah,
I fully agree on this. And this is something that we also approach because we don't do any menu therapy. We don't really touch the body. However, when we do evaluations based on movement and exercise, we try to keep that in mind. So when we do the specific exercise or corrective exercise for certain things, we always want to make sure that the fascia it's co-contracting properly, not isolating the muscle groups. Because we know that fascia will control the compensation pattern. So if you have a local, for example, fascial densification, you could cause a issue remotely somewhere
yeah.
else. But if you're just doing, local type of work, focus on the muscle alone, that doesn't really solve all the problems. So
And
wholeheartedly agree with you.
I think that's where a lot of temporary relief comes in.
Yeah,
And people say, it keeps coming back. If something keeps coming back, you're missing part of the picture.
exactly.
Like if I'm treating the same thing three, four treatments and nothing's changing, I'm missing something. That's just how the way I see it. Depending on what it is, certain things take a little longer to make change to, depending on obviously how long that change has been in the body, and especially when it comes to like fascia and tendons and ligaments, any sort of connective tissue, it will actually thicken over time or become less. Uh, it becomes like more viscous, like the fluids and tissues become so they glide a little bit um, less efficiently, which
Yes.
then, creates compensation patterns in and around itself. So I have a question for you. If you don't do any manual therapy,
Hmm.
let's say someone has a lot of irritation in their fascia somewhere that you figure out through your assessment. Um, do you the terminology might be a little different here based on how I say things, but I'll try to explain it. Do you ever go, do you know what I mean if I say like direct treatment versus indirect treatment?
Directly, you'll be directly treating the area where you have the pain, indirectly, as in you're going remotely. Is that what
Okay,
you mean?
okay. So no, that's not what I mean. I'll explain a little bit more, but yes, that makes sense too. Indirect. Okay, so basically what I mean is like if the fascia if the fascia's motion of preference, that's the best way to put it, let's just say is like this. I'll give an example. Let's say you work from home and you have one computer here and one computer here, and you're always working in front of you and turning to the right, and working in front, turning to the right. And you do this day in, day out, 8 hours a day. Eventually, the body's going to adapt and start to favor this type of position. So it's not the fact that this is like the problem. The problem is the fact that you're never doing the opposite movement. So the
Right.
body starts to adapt into that position,
Right.
which usually over time will create the body to be more restricted going into that opposite position.
Yeah,
Okay.
because you never do it, right? Never
Yeah,
doing it.
yeah. The body just
So
adapts. So let's just say you assess that and you notice that like fascially things are kind of gliding this way. So what I mean by direct and indirect, I mean direct, like for me, if I was treating the fascia, direct means you're going against, so you're going the opposite to what the fascia wants to do. So
hmm
like I would maybe glide someone's fascia this way and hold and get them to take some deep breaths. And as they breathe, I'm starting to glide the fascia a little bit more. Or maybe I take them into a left rotation and get them to increase their rotational function this way. That would be direct. Indirect would mean you're going with the tissues. So sometimes I would use this approach if somebody is highly, highly acute and they're very sensitive. Sometimes going direct, doing what their body does not want to do, it creates a reflexive contraction and their body will actually go into spasm. So sometimes in my treatment, it's not the best approach to go direct. Sometimes I have to go indirect, actually work their body into what it wants to do, allow the sensitivity or the um yeah, I guess
the
the
nervous
sensitivity of
system, the nervous system
yeah,
also.
allow that to calm down a little bit and then slowly bring them maybe into their direct position. Whatever. If
I
you do
understand.
you yeah, do you
Uh,
use sort of that mechanism sometimes?
Sometimes, yes. That's where especially the rotational movement come into play. So majority of the exercise we're doing is because we're not touching the people, we're only doing the training. So what we're trying to do is number one is the speed. So
Yeah,
like we don't want anything that's too fast. So a lot of people they in the gym they're so used to that fast motion and fast speed that they do everything at the same speed. So what you said there, the indirect way of moving the body, we also do that. We want the body to move very gradually. It's almost like for example, the fascia and how the ligaments and muscles contract together. It's almost like a piston with the oil, right? So you want to do it very slowly to one direction, and then you gradually move to the opposite direction.
yeah,
So we
right.
would be doing these type of movement that according to what we find, right? So
Yeah, yeah.
absolutely. So
Nice.
it would in fact contain, what you just said there, indirect and direct way of treating the body from a movement perspective. Yes.
Yeah, I was just at the gym earlier and I thought of a good example of why this sometimes works. I had a weight belt and the chain was fully tense and I couldn't reach, the clip to put it in. So you have to slacken the tissues, to be able to connect it. And sometimes in the body, when you slacken things, like you mentioned, it gives that neural response a little chance to just become more at ease, less irritated, and then you can go into that challenging position.
Exactly. Absolutely. And what we are also encouraging people to do is the fascial release and fascial rolling, using different sizes of tennis balls or rollers, try to roll out the body to increase the global fluid exchange because your fascia is like a sponge, right? So there's a lot of it could contain when it's stagnant, it could contain a lot of these inflammatory neurotransmitters, and then they're stuck, right? So you really want to, from a manual therapy side, you want to encourage the flow. And this is also, I
I'm
don't,
happy you brought that up. A lot of people talk about rolling for, again, stretching tissues. But I think what you just mentioned is by far a way greater benefit and something that can actually be proven, you know?
yes, yes, that's something that we have seen. And also, I think, from a fascia research point of view, like for example, there are uh, a lot of the mainstream, especially in sports performance, that's mainly the field I'm in. A lot of coaches will say, okay, no stretching, they're against stretching, but from the fascia point of view, you want to be stretching. You want to get additional fluid into the tissue, especially, we know that from fascia research, 20 minutes after a proper stretch, you actually increase the fluid back into this tissue, right? So it's really rehydrating for this tissue.
Do
Um,
you have a suggestion on static versus dynamic stretching before or after exercise?
yeah, so not if you're, for example, if you're doing explosive movement or you're trying to lift very heavy weight.